I think we need to continue this collaboration and cooperation. I was just saying to Madam Chair, as we have established these ECSA colleges of health sciences, we also need maybe to develop country guidelines for different diseases and report them, like she said, to the Secretariat. And later on, as ECSA, we must have guidelines for treatment of certain diseases such that our graduates are literally fluid. On top of that, as ECSA, we must be able to say Uganda produces insulin, Zimbabwe produces antihypertensive drugs for ECSA, Tanzania produces glucometers for ECSA. This is where we are going, and I'm sure the Secretariat, if we support them, will be able to do this easily, and we will have a gold mine of data that we can publish for ECSA, and this will make us more competitive in the region and internationally. Because once we are through with what we are doing locally, we then need to say, as a region, we must be gross exporters of our human skills, of our products, and all that. That is where we should aim to go, rather than to remain consumers of goods from elsewhere. And we should also strive hard to be able to look after ourselves. I think this is why we are gathered today. And as such, I would like to say we have reached the end of the 67th Health Ministers Conference. The type of deliberations and contributions over the past 3 days were quite exciting, and they were held here in this room that confined you to make our chair-led so happy. We feel honored to have hosted the conference, and all of you in Zimbabwe, I wish to declare that Zimbabwe remains committed to the aspirations of ECSA, health community, in collaboration for better health in our region. We began the conference by presenting ministerial statements on progress made towards implementing some of the resolutions we have passed. We need to continue the practice as to ensure that we remain focused, like I said, and improve accountability aspect. Accountability must be respected and something that we want to emphasize. And we must go and implement what we have discussed here. It's pointless next year to come and still seeing the same thing, to say 2003, this conference said this, and today, 13 years down the line, we are still singing the same song. So I think we should change that attitude. In Zimbabwe, we have the new dispensation. We are for action. So we hope we instill this into ECSA as well. I'm particularly impressed with the various innovative programs that are being implemented in member states and notable achievements that have been made to date. Indeed, there is much potential and opportunity to learn from each other. You see, like I was talking about witchcraft, we learned that our witches are the same, their theme is the same, they are good psychologists, and we have everything in common, even dances. Most of us were dancing to things we didn't hear, but I liked my Tanzanian friend. That's clear. Because you find singers have started it. The Tanzanian, what's his name? Diamond, Platinum, and Platinum, okay. And Ja Praiser, Mukudzei something, yes, are singing and producing very nice music. So as ECSA, we can also produce very nice music for our region and for our people. I believe some of the issues we discussed in the conference would require the review of the policies, strategies, and adoption of innovative approaches in order to realize targets. And we need to change our attitudes towards our work as ECSA, because most of our attitudes will leave us sitting around tables for a long time without implementing this. And we need to remember that for us to succeed, we need to avail resources so that we can make the Secretariat's work easier. And we must be able, again, to make sure we look after our Secretariat properly as a region, rather than to make them depend on benevolence only. In that regard, I would like to acknowledge and appreciate the support we continue to receive from our collaborating partners who have availed both technical assistance and funding to drive our regional agendas. In our culture, we know that friends are really very important. So we would like to thank them once again. Let's give our collaborating friends a pam-pam, please. In that regard, we would like to encourage more partners to support our cause and also emphasize the importance of working together in order to harmonize our interventions and increase the impact of funding. So, as I conclude, honorable ministers, ladies and gentlemen, let me invite you to take time to explore the beauty of Victoria Falls, one of the 7 wonders of the world. So you guys are privileged. You know, the world is big. You are seeing number 7 in the world. So you are all invited. We also encourage you to try and enjoy the cruise up the Zambezi River. And remember to take small souvenirs to your country. I also would like to encourage you, those who like good pictures for postcards, to try go up there, walk with the lion, live lions, real ones, not, yes, try that. Try to ride on top of an elephant and be on top of the world. So you can try that, and we can enjoy ourselves, and you'll see different animals, real ones, not, okay? Not on TV this time. So try your luck with a lion, and you have something to remember forever. So on that note, let me declare the 67th Health Minister Conference officially closed. Thank you.